Can I walk if I have a meniscus tear? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. And I got to ask that question, so watch this video to see the answer.
Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
Certainly, most people who have a torn meniscus can walk. It depends on what type of tear it is. I had a torn meniscus myself in the past, and it was what we call a flap tear, where the piece was flipping back and forth, getting stuck in between the two bones, the femur and the thigh, which is the thigh bone, and the tibia, which is the shin bone. And so it was locking my knee up. So it was making it difficult to walk. So there are different types of meniscus tears. And if it's more of a frayed or degenerative meniscus tear, most people can walk, and they may have some pain. They may not have pain. They may not even know it. And you'd be surprised. Sometimes meniscus tears that are not going to heal on their own and might still need surgery, people can walk fine on. But then if you squat or you kneel or you twist or you turn, sometimes you got to be worried about that piece flipping up or tearing worse. Can you walk or should you walk? Because yes, you can walk, but the next question is, should you walk? If you have a known meniscus tear and it's what we call acute, or it just recently happened, or it was a traumatic injury, meaning it happened from an injury, and it is causing mechanical symptoms like locking up, your knee gets stuck and you can't move it, you can't bend it, you can't straighten it, or catching, or a lot of pain and swelling, then walking probably isn't the best exercise for it, because it's probably going to aggravate it. Now, walking for normal daily activities, as we just talked about, you should be able to do most of the time. But if you're having mechanical symptoms, that definitely should be something that you get in to see an orthopedic surgeon, and you most likely, not always, but most likely will need surgery. If it's more of what we call a degenerative meniscus tear, there's two types of cartilage, and then there's the cartilage on the end of the bone, which looks like the white on the end of a chicken bone. It's kind of like the tread on a tire. When that wears down, that's what arthritis is. But there's also meniscus cartilage in between, which is what we're talking about, which is little shock absorber cartilages. Well, just like the cartilage on the end of the bone can wear down, the meniscus can wear down too. And if it's just more of a wear and tear, and it's not really aggravating the knee, then some people exercise, like walking is great. Running or jumping might not be great, but walking might be a super exercise if you have degenerative or quote complex meniscus tearing. So it depends on the type of meniscus tear, depends on the symptoms. And I think that's probably the best explanation for that.